Hello, and thank you everyone for joining us again today for our weekly Facebook Live update with Lauren Hamill from Spectrum Health Lakeland and Nikki Britton from the Berrien County Health Department. So Dr. Hamill, do you want to start us off? A lot of conversation has been around hospital capacity and where we're at. So if you can just provide an update for us.
Yeah, we are officially listed as at capacity, which is mostly true with some maybe qualifications. Our hospital is nearly full. We discharge about as many patients each day as we admit, but we're not on diversion. We also have opened up a number of areas within the hospital to take care of patients that are not normally used for inpatient beds. And we're able to accommodate more than we currently have should the need occur. We are running in general about 60 to 65 inpatient COVID patients every day. What's new since we talked last on this is our ICU is running essentially full. We have about twice as many ICU patients with COVID as we did a week or two ago. And that's 4, 5, 6, 7, something in that neighborhood every day. But with the other folks that need the ICU is running essentially full. And of course, that's concerning. We are grateful that the inpatient COVID cases over the last 2 weeks have not continued to expand rapidly. And I just want to say thanks to each one of you for doing your part to help slow the spread of COVID in our neighborhoods. That's been very useful. But when we look at the current trends and the current positivity rate and the current new diagnosis of COVID, we're projecting that number that's in the 60 to 65 range of COVID is going to go somewhere between 83 and 112 in the next couple of weeks. And so we would just say, please continue to be as diligent as you can be. The lives you help save might be your neighbors or your loved ones. And we really appreciate that.
Thank you. And going off of that, there was some confusion about stats that are being shown by the state that do show us at 100%. And people are concerned if they have other conditions such as heart attacks that they can't come to the hospital. Do you want to address that?
You're absolutely making room for you. If we expand in COVID, that COVID expansion is going to go into units that are not typically used for inpatient care. And we have another 27 beds we can open to accommodate those additional COVID patients. We are completely committed to take care of the heart attacks and the strokes and the injuries that occur within Berrien County. So you can count, we're doing everything we can to be there for you if a medical need arises.
Thank you. And perhaps both of you can address this next one. So obviously we had Thanksgiving holiday last week, and a lot of people are wondering if we're going to see a surge from that, when we will see the surge. So can you talk about what we should be expecting in terms of Thanksgiving and social distancing?
Yeah, Thanksgiving has really thrown a bit of a monkey wrench into a lot of our data. If you're following along with any of our data and our number of cases, we've actually seen a bit of a slowdown in the number of new cases being reported on a daily basis this week. And that could be really encouraging, but we need more time to tell if that's a real trend. We know there were a lot of testing centers that were closed Thursday through Sunday of this past week, and that could be the reason we're seeing a bit of that slowdown in cases. And in fact, it will pick up. It's also a little bit too early to tell what may have happened as a result of interactions or gatherings or potential transmission that took place over the Thanksgiving weekend. The incubation period can be as long as 14 days for COVID-19. The average person is probably going to show symptoms within 5 to 8 days. So right now we're on day 8 past Thanksgiving, and we know that a lot of people wait a couple of days after symptoms start before they get tested, and then it can take 24 to 72 hours to get those test results back. So next week is when we're going to start to see more of that impact on transmission, and then it'll probably be another week after that before if there was an increase, that increase starts hitting the hospital just based on the timing of the disease process. So there's sort of two ways that Thanksgiving has had an impact on what we're watching and what's happening: the testing and actually the identification of cases that are out there, but then also the potential increases in transmission.
Thank you. And off of that, we have a few days left of the, can you talk about that? Have we seen any difference in our trends with rates of COVID related to that, or any positive outcome?
Yeah, so I mean, as I mentioned, we are seeing a little bit of a decrease in our number of cases, and I'll actually share my screen just to show a little bit of what we're seeing. With a lot of epidemiological data, it's difficult to make sense of it until it's passed in real time. It can be a little bit more tricky. But when we look at our epidemic curve and our number of cases, we have the steep increase we've been part of, or that we've been experiencing. We've peaked at about this 166 cases per day as an average. And then we're starting to see a little bit of a decline. Now, this is what I was saying, we're going to need a little bit more time to see what those trends really are. But if this truly is a little bit of a stabilization of that increasing trend, the timing does make sense that if there was a decrease in people's activities around the epidemic order, and even earlier, because it's been 4 weeks since Dr. Hamill and I first came before and said, this is getting very urgent and the time is to act now before we hit that crisis in the healthcare system. It would make sense that if our community was doing these things and we were getting more diligent in these health and safety measures, we would start to see that leveling off right about now. So time will tell. Maybe by next Friday, we'll have a little bit better perspective on what's happening. But you can see here, we don't know how much of this is an artifact of just less testing versus we're actually seeing some leveling off. The fact that we're seeing a little bit of a leveling off right now for hospitalizations is encouraging and another important piece of interpreting this information.
And we also heard this week that the CDC has revised their guidelines for quarantine and the timeline. It's a little confusing for people. Do you want to walk us through what that looks like?
Yeah, so there has been basically a change in options for quarantine. So the 14-day quarantine is still the gold standard. It is still recommended that be observed for people who are exposed to COVID-19. However, when science and research shows that there is a different path forward, we try to implement that into our guidelines. And I know that can seem confusing when things do change, but it is good that we're putting the latest research to practice. The latest research is showing that 99% of people who are exposed to COVID-19 and begin to show symptoms do so within the first 10 days. So in an effort to try to make quarantine less burdensome and have less of an impact on education and workplaces and businesses and the like, and there is an option for shortening quarantine to 10 days with a very minimal risk of somebody within those last 4 days of quarantine. There's very little risk. It still exists, but there's less risk if we do this 10-day quarantine. There is a lot to be gained by having students back in seats, workers back at work, especially in key industries. So that option is out there. And so that is something, as the health department, we are moving to utilize that option. There may be some really high risk situations, some really vulnerable situations with vulnerable populations that we may continue to recommend that 14-day. Regardless, individuals would have to monitor their symptoms the entire 14 days. There is also another component in that CDC option that if somebody receives a test on day 5 or later in their quarantine, and that test result comes back negative, they could be released from quarantine by day 7. However, the big caveat with that is that testing to shorten quarantine is only an option that's feasible when you have an abundance of testing resources. In Berrien County, we are not in that situation right now where we have enough testing that everybody who's in quarantine who wishes to be tested on day 5, we just don't have the capacity to support that in our community while continuing to identify people who are truly ill. Now, if somebody is actually developing symptoms during their quarantine, they need to be tested. But if it's somebody with no symptoms who simply wishes to get out on day 7 instead of day 10, that's where we are not able to exercise that option here in Berrien County. right now. So for now, we are working with individuals for that 10-day quarantine option.
Thank you. And that leads well into our next question. So Dr. Himmel, there's been a lot of confusion as well around just the different types of tests that are out there and what we offer, what is the gold standard. So can you talk about that as well as what's available at Lakeland and what's available throughout our community?
Yeah, certainly. So the test that we're doing at Spectrum Health Lakeland is considered a molecular test. It tests for actually the genetic material of the virus. We're doing a nasopharyngeal swab for symptomatic patients. You can also do a nasal swab for asymptomatic patients, and there are a number of sites in the community that are doing that kind of a test. We're doing hundreds of tests every day, but we do not have enough tests for asymptomatic individuals. So there are folks that will call and say, I'm traveling to wherever, and my airline says I need a test. And we're having to say to those folks, first, be careful about travel. There's additional risks there, but we're not able to do at this point the test for asymptomatic individuals for that kind of a purpose. Those are usually nasal swabs, and it can be done in a number of testing sites, including some of our pharmacy partners. And we appreciate them stepping up and having tests available. There are also a test that you can do on saliva. Those are the least reliable tests. We're not doing those tests.
Thank you. And Nikki, we also have some questions about the level of immunity that people have after they've been diagnosed and recovered from COVID and how they should be acting or interacting with others. Can you speak to that?
Yeah, so the clearest guidance we have right now is that if somebody has had a confirmed COVID, a confirmed case of COVID for 90 days beyond that, they are considered to have a level of immunity. So if they are exposed to another person with COVID during that 90-day period, they do not have to quarantine again. If they get a positive test result by being tested again, it is assumed that that is residual from the confirmed case as opposed to being a new infection. There is research out there that does indicate that the immunity probably lasts longer than that 90 days, but right now that is the guidance and that is what the health department is recommending. It's that 90-day window. We're hopeful that that guidance may be extended further by CDC based on some of that research that is emerging. In terms of what to do for family gatherings, or do you feel like you have a free pass if you had COVID? It can be. We wouldn't want to hang our hat on that entirely because we don't know enough about how how there might be some variation in that natural immunity, what individual factors go into that. So we would encourage people to still practice the safety measures. If you have had COVID, you still choose to gather with family at Christmas, for example, that's your choice and you're able to do that. We would still recommend that you have some of the preventive measures in place, particularly if you're going to be around other vulnerable individuals, just to try to help reduce that transmission.
And I think the big topic that's on everyone's mind is vaccines and, where are we at with that? When we do hear a decision from the FDA, what is our plan here locally to roll that out? So maybe Dr. Himmel, if you want to start from a health system perspective, and then Nikki weigh in from a community perspective.
Well, a week or two ago, we were pretty optimistic that we might get 30,000 doses. We've now been told we're going to get 995 doses. We have freezers big enough for hundreds of thousands of doses. 995 doses is way better than none, but it's way less than we need, obviously. Now, that's going to have to be prioritized, and all the recommendations from the Advisory Council on Immunization Practices from the CDC are spread to the states and spread to us. And that is going to start with healthcare providers in the highest risk areas, as well as nursing home residents. And the initial allotment won't nearly cover that amount of employees, nor the residents of all the nursing homes in Berrien County, Kenton County, and the 16 counties that Spectrum Health serves. So we're excited to get them, but I think it's going to be a rollout over a number of months. I expect there are going to be some folks that we really wished they would take a vaccine, and they're going to say no thank you. There are going to be others that are really anxious to get a vaccine, and we're going to have to say not yet. And that's just the nature of kind of rolling out vaccines over a number of months. There's going to be a little confusion, a little chaos. We expect these vaccines to be safe. We have not yet seen the peer-reviewed journals on the safety of the vaccine. We expect to see those in the next few weeks. But the vaccines are made by reputable companies that have been doing this for a long time, and the safety profiles in general are fairly well understood and anticipated. There's no such thing as a risk-free vaccine, but there are a lot of vaccines that are extremely low risk, and the benefit is markedly greater than the risk for those, markedly greater than the risk for those vaccines. So we will certainly try to keep our staff and our patients appraised of the latest data on risk and benefit, but I'll hold my hand up early when it's my turn to get a vaccine. I'm going to take one because it not only helps protect my health, it helps protect those around me. And I would encourage you to consider doing the same. We anticipate after the FDA takes a look at this in the next, at the end of next week, we expect there to be an affirmative response. We expect that vaccine to start rolling within a few days. And we have had a large team of people working weeks and weeks and weeks to make sure that they're ready and we can effectively immunize our staff and our community.
Yeah, and similarly, so the health department has been working very closely with Spectrum Health Lakeland and other partners as well. As Lauren just spoke to, the first highest priority groups, as priority group 1A, is healthcare workers and nursing home residents. So we're working out who is vaccinating who. There's some key players in the community. All of that is being worked through because the distribution of a vaccine like this, as you can imagine, there's a lot of complexities there. Going back to the safety and efficacy, like Lauren was mentioning, I think it's worth explicitly stating that these vaccines that are going through approval, we have 2 companies right now that have requested the emergency use authorization. There are several more that are quickly on their heels. So even though we have a very limited supply of vaccine coming in the initial weeks, it will ramp up over time. Even though, yes, it will take months to get everywhere, it will start to ramp up fairly quickly. But the clinical trials that have happened for these vaccines have gone through all of the typical paces and process of any vaccine clinical trials. A lot of where the speed comes into play is getting through some of that bureaucratic red tape. Sometimes there are meetings or committees that must approve these sorts of things or review data that might only meet once a quarter or every 6 months. Those processes have all been accelerated, not necessarily at the expense of science. So again, we're going to be watching for that peer-reviewed data. We're going to be looking at those safety profiles and data as well. But warp speed does not refer to the testing. That refers to all of that bureaucratic red tape, access to resources, all of the things to drive in that direction. So we want you to feel comfortable that there have not been important corners that have been cut. There has been bureaucratic red tape that has been cut, and that has helped increase the speed. So we're going to continue with the distribution. More details will be forthcoming as we know more about vaccine amounts and exactly how this timing is going to play out. But I think the general public, for healthcare workers and nursing home residents, we expect to start vaccinating perhaps in December into January. And then in that 1B group, that next tier is going to be more of your critical infrastructure workers, other people that are at risk. So it'll start working its way that way. So we've got a lot of work ahead of us in the next few months, and there's a lot of planning that is going into this.
And I might just add that as Nikki and I talk with you again here in a week or two, we'll share with you all the details of that plan. As we have firm dates of when they're going to arrive and when we're going to start, and all the different categories of folks that are eligible for vaccination. We'll make sure that's all clear to everybody. At this point, just know that for the general public, that vaccine is not going to be available in the next 2 weeks. You know, we get called and say, hey, can't I please have a vaccine before I go to Acapulco? No, I don't have any vaccine to give you. And by the way, you shouldn't maybe be going to Acapulco. But so hang tight, and we hope to get those vaccines to you very soon.
Thank you both. And going off of that, you both mentioned it's going to be a long process. And I think, can you speak to the importance of preventative measures, continuing those throughout this process? It's not something that masks can just magically disappear.
Yeah, we're going to have a really messy period, probably through spring and early summer of 2021. I predict maybe longer, maybe not. But we're going to have this messy period where we're going to have people who've been vaccinated, people who haven't been vaccinated, people who have been sick and have some level of natural immunity. And everybody's still going to need to be continuing to wear masks, socially distance, do the hand hygiene, have smaller gatherings. Once the vaccine is out there, that does not mean that all of these other preventive measures need to immediately or can immediately come off. It's going to be a little bit of a slow peeling back some of the layers of prevention as we're able to lean more heavily on the other. But that, again, is going to depend on vaccination rates and how many people we have in the public who have that immunity so that we can peel back some of those other things. So it will probably look a little bit messier in the spring, and masks may still be required even if you've received a vaccine. There may be a period of time where you will be both vaccinated and wearing masks in public.
And one final question before we wrap up, Dr. Hamill, we're still asking people plasma, speak to some of the ways that we're treating patients who have COVID and are coming to the hospital, or what advancements have been made there.
So we have all the treatments available that are generally available to treat COVID, including convalescent plasma, remdesivir, dexamethasone. We are monoclonal antibodies. We're doing our best to make those available to everybody that needs them. The supply is tight on some of those, and certainly if you have had COVID and recovered, I encourage you to be a plasma donor. That's still something that we're employing. It's not magic, but it's absolutely helpful, and we'd like to make that available to those that get sick. And I would just key off what Nikki was saying about it's really important to continue the masks, even through this period where some folks are developing immunity and when some folks might get immunity through vaccination. We are still losing most days one of our precious neighbors in Berrien County to death from COVID-19. So I'm optimistic that if we work together, we can blunt this surge, we can keep the hospital from being overwhelmed, and we can protect the vulnerable among us. But we're not there yet. And most days we're still losing somebody in our county to COVID-19. So please, hang in there, be diligent, work together. We want to keep businesses open. We want you to enjoy your family. We want to get through this as much as you do, but we want to get through it with as few lives lost and as few people suffering the loss of a loved one as we possibly can. So please continue to be diligent.
All right, thank you both, and thank you everyone for tuning in today. We know there's a lot of information out there. You can continue to visit the Spectrum Health Lakeland and Berrien County Health Department websites and Facebook pages for the most up-to-date information going forward. Thank you.